Hello, welcome to New Nurse Academy Journey to NCLEX channel. I'm your greatest, your bestest, your personal clinical nurse educator, Tiffany Gibson, here to get you prepared for your road to NCLEX, giving you some tips so that you can successfully feel confident, competent, and ready to pass the NCLEX. So I have some common NCLEX traps for you to not fall into. We want you to avoid these traps. These traps are put in the test on purpose to trip you up. We want to make sure that you don't do that, all right? So the first trap is don't ask why. When you are given a question about therapeutic communication, your answer should never be why. Why can come off as offensive, and the other person that you're talking to, usually the patient, will get defensive, and that is not therapeutic. When you are having a therapeutic discussion or have a question about therapeutic communication, you definitely want your response to elicit more information from the patient. So you always want to refer to your gold standard. Tell me more. How does that make you feel? What are your thoughts about this? You always want to elicit more questions and thoughts from the patient instead of asking them why, because that can come off as very offensive. The next trap is never leave the patient. Your answer option should never be you walking away from the patient. Safety first. You should always be at the bedside. If you need to call for the nurse or a doctor or someone else to come into the room, you want to use your call bell, you want to press the code button, you want to use the phone, you want to yell for help, but you never, ever, ever leave the patient by themselves. The third trap is saying, don't worry. You're giving false assumptions to your patient by telling them not to worry. Patients and their caregivers have a right to worry. If they're sick, if they're in the hospital, if they just received some bad news, lab results, x-rays, whatever, worrying is a natural emotion to have when your health is on the line. So having a response of don't worry is giving false assumptions to your patients. Fourth, don't read into the question. Look at what the question is giving you and take it as just that. Do not add any work experience that you have. Don't recall that last time you were on clinical and you had a patient with a similar situation and this is what the nurse and the doctor did. Remember, the NCLEX is written in Perfect Hospital USA, where you have all your orders, you have all the staffing, you have the latest technology, innovation. The doctor is right there. What you do in your hospital, at your job, at clinical, at school is not what happens during the NCLEX, okay? So when you get a question, you want to take the question as just that. Do not add more into it. Do not add your life, your job, your personal experience into the question. Take it for what it is and leave it at just that. And then lastly, do nothing. There's always something for the nurse to do. Your answer should never be do nothing or passing the buck. Either as the nurse, you are going to do an assessment to gather more data, or you're going to do an intervention. Remember the nursing process, ADPIE, assess, diagnose, plan, intervene, and evaluate. So there is always something for you to do as the nurse, whether you are the RN, the LPN, or the LVN. Your answer should never be do nothing, and you should never pass the buck. Hope these tips help. Please like, rate, review, subscribe to this channel, share with your friends, come back for more. Trying to get you on your journey to NCLEX. And if you loved what I have going on here, please write a comment below. And if you'd like more one-to-one personalized nursing education, follow me over at newnurse-academy.com and schedule a one-to-one consultation call. Talk with you soon. Bye.